Good evening, everyone. I'm Tim Killeen, President of the University of Illinois System, and welcome, friends. I hope you and your families and communities are safe and well as we all stay apart to do our part to slow the spread of the COVID-19 virus. My thanks to all of you for taking the time to join this evening's virtual town hall. These live interactive call-in sessions provide an opportunity, a chance for me to connect with people across Illinois in our universities in Urbana-Champaign, Chicago, and Springfield. We're so proud to serve. It lets us share firsthand some of the many achievements of your state's flagship university system and gives you a chance to ask questions or tell us what's on your minds. So if you would like to ask a question or make a comment at any point during this conversation, please just press *3 on your telephone keypad. That's the key. You will be connected with a staff member who will take your name and your question or comment and then place it in a queue to share with me and our other listeners. Let me start our discussion with a very brief history lesson. From the beginning, dating back more than 150 years, the U of I system has existed to serve both students and the public good. We were created under a visionary act signed by our own Abraham Lincoln that launched a nationwide system of land-grant universities that has served the needs of progress ever since. And this land-grant mission revolutionized higher education, tying it to the needs of society and challenging universities like ours to look ahead, to pioneer solutions and produce the next generation human and intellectual capital to move America forward. That bedrock mission has helped lead Illinois and the nation from the agrarian society of our founding through the Industrial Revolution and into the digital age, where the U of I system's many unique contributions include, as you know, the first user-friendly browser, the first chat rooms, and the first educational software, things that we are all using these days. Abraham Lincoln had a quote that I like to use. He said, "Be sure you put your feet in the right place, then stand firm." For me, that exemplifies the land-grant mission. We have our feet in the right place, had them there for a long time. Now we need to stand firm. So for today, you can see our land-grant mission in action in real time through our many ongoing contributions to the battle against COVID-19. We have done more than just shift education from classrooms to online, sending nearly 90,000 students home to study and to provide the physical distance needed to slow COVID spread. We've done more than fight COVID on the front lines at our teaching hospital in Chicago with its 17 clinics, where our dedicated healthcare professionals are working around the clock and have provided critical treatment that sent home about 800 patients who had tested positive for COVID and recovered. And as we've done more than graduate nearly 200 doctors early this spring to meet ever-growing national demand sparked by COVID, about 2/3 of this year's graduating class from our Chicago-based medical school, one of the nation's largest, now on the front lines. Beyond those important contributions, we are also writing the next chapters in our land-grant legacy by marshaling the world-class expertise of our universities, and it's truly world-class and multidisciplinary, to tackle COVID's challenges head-on as they happen, helping state officials manage the crisis, safeguard our citizens, and chart the path to economic recovery. Here are just a few of the many life-changing examples of this, and I hope you will share a little bit of my pride in the magnificent response of the University of Illinois system to this challenge. And remember, press *3 at any point to get in line to leave a question or comment. The staff member will answer the phone to confirm your name and information. The U of I system is at the forefront of research towards treatments and possible cures for COVID-19. UIC, for example, has been part of 3 national cutting-edge clinical trials, including one for the antiviral drug first used to treat Ebola that is already proving effective in shortening recovery time. We were amongst the first hospital systems to conduct that national trial, and it was truncated when it was discovered statistically that it improved patients' prospects. And so patients who otherwise might have got a placebo are now getting the drug. At Governor Pritzker's request, our DPI, or Discovery Partners Institute, is coordinating efforts to expand testing across the entire state of Illinois, a key to both public health and reopening the economy. Experts from across our system are routinely providing up-to-date research to guide ongoing prevention efforts by the Illinois Department of Public Health and the Governor's Office, 2 calls a day. And that includes something of which I'm very proud, epidemiological models, top-tier models from researchers in Urbana and other institutions that demonstrated how heightened physical distancing can avert a critical shortage of intensive care beds in Illinois. Models cited by Governor Pritzker as a factor in his decision to invoke statewide stay-at-home orders, making Illinois the second state in the nation to have such a mandate and the first to preemptively do it, saving tens of thousands of lives. We have also helped lead the way in providing tools for the fight against COVID. Chicago is fabricating innovative and effective masks for use in hospital settings. Urbana-Champaign is producing hand sanitizer at industrial scales to ease shortfalls. Both universities are developing sanitizing approaches to allow reuse of masks and other protective equipment. And Urbana-Champaign's Granger College of Engineering has developed a prototype emergency ventilator that holds promise to help fill a gaping international shortfall. At the state's direct request, Springfield has been sharing its expertise as a pioneer in online education to help colleges and K-12 schools across Illinois transition to virtual learning. And about 36 experts from across our system are examining the economic repercussions of the pandemic and how Illinois can best rebound from a downturn that could be worse than the Great Recession a little over a decade ago. Remember, please press *3 at any point to get in line to leave a question or comment, and a staff member will answer the phone to confirm your name and information. So these are just a few examples of the land-grant power of the U of I system and what its 3 best-in-class universities, including 2 top-tier research universities, bring to the people of Illinois. But as we work to help the state weather its challenges, we face COVID-19 challenges of our own. The crisis has cost the University of Illinois system more than $160 million and counting in prorated refunds for spring room and board and fees, additional pay for frontline healthcare workers, lost revenue from events and other costs, and more cost problems lie ahead with summer classes moved online and events canceled. I am confident that we will reopen campuses for the fall, but it may look different from past years. There will be new costs for cleaning, testing, contact tracing, treatments, or vaccines and other measures to ensure the safety of students, faculty, staff, visitors, and all of our neighbors in the communities we call home. So we hope you will all support our efforts to secure the robust state funding and national funding, federal funding, needed to sustain our important contributions to the state. We recognize, however, the difficulties that the governor and the legislature will face in this year's budget cycle, but funding for the U of I system is an investment that will pay rich dividends both today and into the future, just as it has throughout our storied past. We develop not only the seed corn of the future human capital, but actually will develop the treatments, cures, and vaccines that will resolve this healthcare crisis that we face. So on behalf of all my colleagues across the University of Illinois system, who without complaining have done all of this transitioning over the last several weeks in an amazing way, thank you for all of your support and for participating in tonight's call. Now, let's go to our first question. Remember that if you press *3 at any point to get in line to leave a question or comment, and a staff member will answer the phone to confirm your name and information. And I'll do my best to address your questions. And if I can't, we'll take them down and get back to you later.
We have Joe on the line from Clinton and Bloomington, and he's interested in the timetable for when campus may reopen. So he's our first caller. Thank you. Joe, go ahead.
Thank you, Joe. Thanks. Hello, Joe.
Mr. President, good evening. I appreciate your taking time out of your busy schedule to address these questions. Pertaining to 3 campuses, do you envision a similar timetable on those 3 campuses reopening for the fall, or congruent with the governor's timetable, or ahead of it?
Yeah, we will follow the Illinois Public Health guidelines and the governor's guidelines. What we envision right now is our 3 campuses opening at their scheduled times, but in a modified fashion appropriate to the health issues that are relevant to that time frame. And we're working towards those goals, and so we're reassuring families and students that we will be open in the fall, and we're telling them they may look at it a bit different. There may be more spatial distancing. There will be more spatial distancing, dining, housing, kind of event management will all be in place to ensure safety and the health of all of our students as they return. So yes, we're working on it. The specific details will be rolled out in sort of about a month's time as we learn more about the change in the epidemic for Illinois, including the differences between our 3 sites. And we'll be, communicating regularly with families and students. But yeah, it's our intention and plan to open our campuses. Incidentally, Joe, we never really closed the campuses. We've had roughly 1,000 students residing on our dorms throughout this period. Students who, for one reason or another, couldn't get home or couldn't go home or needed access to the infrastructure that would allow them to continue their studies. So that's, in essence, in thumbnail sketch, our plan.
Is that similar to maybe some of the things that President Daniels at Purdue has been talking about for several weeks?
Yeah, we're looking at all peer university systems, and there are some similarities, some little differences in approach, but I think we've got some quite similar approaches to Mitch Daniels in Purdue.
Thank you, Mr. President.
Thank you, Joe.
Thank you. We have an online question from Julie. How is the system helping poor students acquire laptops and internet access to continue online classes? And she thanks us for what we're doing.
Yeah, thank you very much, Julie, if I got your name right. We're doing everything we can. In short, we've purchased many laptops for students who needed them. We've purchased hotspots for students where their circumstances were such that they didn't have real good access to the Wi-Fi. And we've worked already over the balance of this last semester, one by one, with all students who have special needs. In addition to that, we're very concerned about obviously the impacts to the economy. We're going to study that, and we're writing reports on economic impact. We realize that the economic circumstances of many of our students and families has changed fundamentally. So we've been working with using our federal relief support through the CARES Act, and we've added about $4 million to that to provide an emergency fund for students who have been financially disadvantaged in a major way because of COVID-19. So we're doing everything we can to make sure that no student loses access to the world-class educational product that we bring to the table, and we'll continue to do that throughout this process. But thank you very much for your question, which I really appreciate. I see there's a question from Amanda Kirsten. Are you online, Amanda? I can paraphrase the question perhaps if you're not connected. It's what is the
Hello.
plan? Hello, Amanda. Sorry. You could ask the question.
Excellent. So we have a question from Jim from Wheaton, and he wants to know how alumni can help. Sorry about that. So Jim, you are live with President Killeen.
Hi, good afternoon, President.
Good evening, Jim.
I'm class of 98, and I'm always looking for opportunities to help out. So with an expansive Illini network and Illini all over the place, is there an opportunity for us in some type of concerted way when we're available to help out with the COVID-19 efforts wherever we are? Whether it's physically in person, making sanitizer, or volunteering computing time or whatever.
Well, thank you for that offer. And yes, there are multiple ways. I mean, one way obviously is in advocacy for public higher education in general, for the University of Illinois system in particular. And right now there is a second CARES bill. It's actually called the HEROES bill in the federal government. That it would be very helpful if you could just write a short note to your representative, telling them how important it is that higher education gets some relief for the financial difficulties that it's receiving now. So that would be greatly appreciated. But I think it depends on your interests and where you live as well, what you might be able to do to volunteer. We've had amazing energy from volunteers. Retired nurses have gone back to work. We've had people donating masks and PPE. We've had people working on hand sanitizer and distribution. We've had people volunteer to be part of the contact tracing universe, and I think those are important contributions as well. So please contact your department or send me a note, and I can pipe in the right direction. This is an important time we're all in it together, as you hear a lot, and I think there's a lot for us to do in a leadership role to help the state steer itself through this crisis in the most advantageous way. So thank you so much for your volunteering spirit.
Our next caller is David from Marion, and he's interested in how the university's computer system has been used to help research on the virus.
Yeah, thank you, David. As you know, we have a supercomputer and a very elaborate set of supercomputing facilities, and it has indeed been activated to do cutting-edge research on vaccine production, on looking at protein folding, and all the things that go into the identification of potential treatments to develop the vaccine. So it's already been deployed in that way. It's also being used to help with the epidemiological modeling, which is these predictive models that really try to understand how the virus is going to evolve and be transmitted into the future. And that's been so important, I would say, in the last couple of months. And it's been very helpful in avoiding situations where the hospital system and the healthcare system can get overwhelmed by the influx of patients. And so determining, the mitigation steps, including the stay at home and the duration of that, is all going to be helped by the computational power that we bring to the table to look at how this healthcare crisis will evolve. And just bragging a little bit, our epidemiological modeling has been really excellent and top tier, and has been very influential in determining the state's response throughout. And we'll continue to do that.
Thanks.
Thank you
our
for
next
your
caller is Letitia from Chicago. She has a comment about what we've been doing and how we're listening to students. So Letitia, you're live.
Letitia, we love listening to students. We enjoy listening to students, and we have to listen to students. And we thought long and hard about the grading scale, because it was important that no student who was really hit hard by this epidemic to have been disadvantaged. And we did listen to the students. We did change the grading scale. I think it was to everybody's satisfaction, pretty much. And just going forward, we're going to continue to do that. I know some people are concerned about students who might be immunocompromised coming back to campus, or some folks who may have some particular vulnerabilities. We're going to provide accommodations the best we can for our students, because what it's all about when at the end of the day is lifting students, their families, and their communities by giving them access to a world-class educational program. And we're going to do that the best we can, the best in scale. And our grading scale discussions were all part of that thinking. But thank you as well, Letitia, for the question.
Thank you.
Our next caller is David from Aurora. David's a high school educator, and he's got a couple questions on online teaching. David, you are live with President Killeen if you'd like to ask your question.
Yes. Thank you, President, for going ahead and addressing everyone. My question is this. I have found that most of the work that we've been doing this spring with students learning at home has been to almost try to maintain what they've learned, not teach a lot of new things. I was wondering if you've had much data this spring as to the effectiveness of being able to provide education through the distance learning that you've been doing.
Yeah, it's a great question. I think it's too soon to be, definitive about exactly what we've learned, because it's been such a recent massive change. But we have experts in the assessment of teaching online programs and cognitive gain that can come from different approaches. And of course, now we have this amazing, in a way, natural experiment of moving so completely to teaching online. What we know is that there are better ways of teaching online and not so good ways of teaching online. And we've been trying to make sure that all of our professors, and of course we teach the teachers as well, and our education colleges that are continuing to educate teachers in online techniques and technologies. I think out of this, we're going to learn a lot of new information about the hows, how to do it and how best to do it, and look at the cognitive gain that individual students have. So we're in the thick of it, I would say, right now. I've been really impressed with how well it's gone, frankly, in terms of, if you think about moving so comprehensively from one modality to another modality in midstream towards the latter part of a semester, and then to put all of that in place. And of course, we are conducting assessments with the students. How did it go? How does it compare, et cetera? We know that online education can be very effective, and in some instances, it could be even better than sort of tutorial things. So I think we're going to learn about blended technologies here. And when we talk about opening our campuses next fall, it's likely to be some blend of online. We're not going to have the 400 students in large classes sitting right next to each other, probably. Those might go online with new modalities and techniques. We're blessed, frankly, with decades of experience in online teaching. So I'm very confident that out of this process will come a really good answer to your question. How effective are these new teaching technologies? And, University of Illinois at Springfield is a national leader in that. And we've been, in fact, asked by the governor to advise K-12 teachers, high school teachers like yourself, on appropriate approaches. And if you have some interest there, we could connect you with key experts at our Springfield campus. Thank you for the question, David. And good luck with your own work.
Thank you.
Thank you. We have an online question from Randy. Today, the Illinois General Assembly announced a limited session schedule for the next week. what message would you like our alums to convey to our lawmakers about the funding for the University of Illinois system?
Thank you very much. I think the message is higher education and University of Illinois system is more important to the state of Illinois than ever. If you ever wanted a demonstration of why it's important, I mentioned the lives saved, I mentioned the healthcare efforts, the patients recovering, the developments of vaccines and clinical treatments, et cetera, as well as all of the teaching and training and graduation of doctors, et cetera. It's time for that message to go in very firmly to the state, that this is too important to the future of the state. This is how you rebuild an economy. This is how you create vitality in an economy. It's how you create jobs, and it's how you solve the issues, the healthcare issues that we're challenged and faced with. So I would not hesitate to wave the banner as high as it could go. There were a few years ago, you may recall, during the budget impasse, I don't think higher education had the level of priority in state decisioning processes that it should have now. We recognize that it's going to be a difficult time, and we're studying that, but this is not the time to back off from a commitment to the intrinsic importance of higher education. We will be coming forward with specific asks of our state legislators, and in fact, we're in daily contact with these decision makers. And frankly, I'm finding personally that there is deep understanding of the important role that the University of Illinois system provides for the state. Now, we would like that to appear in a robust budget that allows us to preserve momentum and carry forward into the future in all these important areas. So please advocate on behalf of your alma mater.
Thank you. As a reminder, if you would like to submit a question, please press *3, and one of our staff members will assist you and take your call. So now we have Catherine from Oak Park. Catherine has a question on international student enrollment. And Catherine, you are live with President Killeen.
Yes, I was just curious what the projection was going to be for next year and how that will impact our budgeting process.
And specifically on international student enrollment, Catherine?
I've got to assume it's going to be down. Well, I assume the international, that we get a big bang for our buck with every international student. And that enrollment is going to be really a big impact.
Yeah, we're looking at that very carefully. Of course, we're tracking daily, weekly, the acceptances and the enrollment numbers. Urbana-Champaign had its deadline for acceptance of May 1, and I can tell you that it looks like a strong year in enrollment, including international students. Now, accepting a position at Urbana-Champaign, still, if you're an international student, there still has to be visas and so forth that may affect the enrollment level. So we are looking at scenarios. We're doing scenario planning, the what ifs. What if it goes down 10%? What if it goes down 15%? And we're not assuming that there'll be the same level of international students in the fall in our baseline planning currently, but so far it's holding up. The deadline for the other two universities, Springfield and UIC, has been moved back to 1 June. So we won't know as much about their enrollments for another couple of weeks. But you're right, it's going to have an impact. Enrollment's very important to us. We've been growing our enrollment. And that's why, in part, we want to reassure people that we're open and we're going to provide the best possible educational experience. And it may have different kind of look, feel to it because of the blended nature that we've been talking about. But if you want a good, affordable, world-class education, come to the U of I.
Thank you.
Thank you, Catherine.
President Killeen, we've got a couple questions on this topic, but we're going to go to Margin from Chicago, who's got a question about sports. in the fall. Margin, you are live with President Killeen.
Hi, thank you so much. Hi, President Killeen. How are you? I hope you're safe and well.
Yes, I'm fine. Thank you, Margin.
Yes, so there's been a lot of media attention around campus sports and sporting events, and I just wanted to see what your thoughts were for this, maybe next year or next semester, and also if you see this as a good opportunity to move away from, the model of athletics providing such a substantial amount of revenue stream and focusing more on the academic side. I guess I'd love to just hear your thoughts on that and the direction we're moving in.
Well, we do everything with a commitment to excellence and integrity, and sports as well as academics. So I don't think about, pitting, different pieces of our programs. But you're quite right that we're looking hard at the kind of sporting events, the kind of congregation of fans, the setting, the spatial distancing that will be required going forward, depending on where the virus is at that time. And we certainly don't want to be in a situation where, because of large assemblies of people, there's an outbreak that we have then to manage and go into overdrive to control and keep tamped down. So I think it's undoubtedly true that the sporting events in the fall will not resume as normal, but we hope and are planning that they will resume. We see our sports programs on our 3 campuses as important to the quality of the educational experience for students. But we will do them, as we do everything, with excellence and integrity writ large. And our guiding principles in everything we're talking about this evening is, number one, the health and welfare of our students, faculty, staff, athletes, and the communities in which we're embedded. And number two, the quality of the educational and higher educational experience. Those are the things that we're going to focus on, and we're going to use all of our expertise to do it as well as is possible in the fall. Beyond that, of course, we all hope that there will be a vaccine and we'll find effective treatments that will really limit the negative effects of this virus, and maybe we will get back to normal. But we're going to be paying close attention as things evolve, and at all times we're going to be basing our decision-making on the best science, the best data, and the best that's available, and that includes with our athletic program. Thank you, Marjan.
Thank you so much. I appreciate that. Thank you.
Please remember to press *3 if you'd like to get in the queue to ask a question live from President Killeen. But we have an online question from Carl. With the apparent abbreviated Illinois State Legislative Session, where is the U of I system regarding its budget?
Well, we are in direct and regular contact with the key legislators in Springfield daily. I mean, Zoom meeting after Zoom meeting has taken place, and we're sort of very closely connected with that decision-making process. We have a budget request that the University of Illinois system put in. Of course, it was prior to the COVID-19 pandemic hitting. We now are repurposing that to what we need currently, and of course we're a little bit looking to the federal programs that I mentioned earlier to help with the budget outlook. But we will be present and available to all the legislative committees and leadership as we have been throughout. So I wouldn't worry that it's an abbreviated session. We're basically all over this, frankly. It's so important to the future of the university, and we could use your help in advocacy.
Our next caller is Walter from Austin, Texas, from Bloomington, and he's got a question about how alumni can help advocate for additional stimulus from the federal government. So, Walter, you are live with President Killeen.
Yes, this is Walter. I appreciate having President Killeen on the line here. I'm very grateful that you're listening to students. Some of the questions have already been echoed, but I'll quickly re-echo it. I'm interested that how can I contribute to the technical computing end of it, given I have a background in bioinformatics? And second of all, there are students that have graduated, and we are, like many other students at U of I, are caught in this stimulus check unemployment thing is. And how can the university, or what channels can we punch to help alumni who are caught in this quagmire of stimulus checks? And everybody seems to be ducking the issue. We can't get in to talk to them. So that has become an issue for past graduates or alumni members.
Yeah.
I know it's a mouthful.
Well, thanks very. No, I've got it. Thank you very much. I think if you were to send in your a little background, a paragraph on your interest in bioinformatics, we could pipe it in the right kind of direction if you're interested in volunteering in some fashion or participating in something. We do our best for any such inquiry. In terms of the caught in the stimulus issues, our role is always to be advocating, just like Abraham Lincoln said, right? Put your feet in the right place and stand firm for the role of land-grant public higher education at scale. And so we are in close contact with our federal delegation, the Illinois federal delegation. Now, I gather you might be living in Texas. Did I get that right? So you have a different federal delegation. But it is an important time, and this is for everybody listening. Okay, so this is an important point for everybody listening. At stake right now is the second CARES package, which is called HEROES, and I've reviewed that. It's an 1,800-page bill that is in draft form, and I would hope that many of the listeners here would find it in their hearts to support that bill, because it has significant help for higher education. In fact, in that draft bill, this is the second bill, this is after the first CARES bill, there's $26.7 billion written in for public universities. That would be a major boost to all the things we're talking about in terms of support for public higher education. So please contact or help us advocate. Illinois Connection can help you do that and point you in the right direction, of course, if you're in Illinois. But if you're in another state, you've got federal representatives that also will be considering this new stimulus package. And it's really important that we do everything we can to optimize the outcome here for higher education. So thank you for even considering that. Malta.
Thank you. We have a question. What economic data is the university providing to help with decisions on unlocking the state?
Yeah, we have a pan-university system institute called IGPA that has activated about 36 faculty, expert faculty. These are financial experts, economics experts, also people who work in areas like family resiliency, small business outcomes, etc. So we have a brain trust of experts that has been mobilized to look at exactly that kind of question. What is the impact to the state's bottom line? What's the impact by sector, by geographic location? And we're documenting those reports, and they're going into the state regularly now, and we'll be updating them as this epidemic continues. But we have, I think, a very fine, world-class group of economics experts who are engaged in thinking that through, and they are coming up with recommendations, not just a quantitative understanding of the scale of the impact, but on recommendations too of what can be done to mitigate damage. So we have great strengths in our 3 universities in those business schools. We have 3 business schools. We've got departments of economics, and them all mobilized to help the state plot its course. You know, I may be biased on this. I know I'm biased, but I think the University of Illinois system is the best asset the state has to navigate through this thicket that has just emerged in history and get to the other side. And we're committed to do that, again, with excellence and integrity, as we do everything, and with objective analysis and avoiding sort of politicization pitfalls that might occur, so that we're an authentic, trusted, and well-credentialed advice system for the state.
Thanks. Next up, we have Helen from Whitehall, and Helen has got a question she'd like to ask about the University of Illinois Extension. So Helen, you are live with President Killeen.
Well, I don't know if I'm speaking now or not. I'm just very concerned that the extension system in the state has gone downhill with the budget problems they've had. Our 4-H program is practically non-existent. The programs offered in our rural county all come out of Morgan County. And with the last reorganization, it just about killed Extension service. What's going to happen in the future with the Extension service?
Well, thank you for being concerned about Extension. It did go through some budgetary difficulties before my time, really, where it went from being in every county to every other county or so. We have very dynamic, excellent leadership in Extension services. They have jumped into the fray on all of these challenges that we're facing, and I'm very proud of what they're doing. And I do hope and plan that as we come out of this into a new normal, let's put it that way, where we're looking at the whole state in terms of its capacity, capabilities, human capital, rural, urban, every setting, that Extension will be sort of reborn in a way that really lifts and propels Illinois in appropriate ways, because really the future is to be taken advantage of. And Extension we're very proud of Extension. It's got an amazing track record that we're very proud about. It's got, as I said, very dynamic, energized leadership, a lot of wonderful people that I've met up and down the state and in the city of Chicago as well. And so it is definitely going to be part of our high priority future. Thank you for your question, Helen.
Thank you.
We've had several questions in our online questions about the mental health of our students and how we're helping there. Is that something that you can address, President Killeen? Thank you.
Yeah. Thanks for that question. I think it's a very important question. The stress of this situation is significant. There's no question about that. We're seeing it in our healthcare community. We're seeing it in our student body, and we're trying actively to help as we can over these online technologies. So we have things like tele-mentoring, telehealth, tele-mental health counseling. We're building communities of students so that they can still feel connected to a community, even though they're maybe more isolated. There are dance classes. There are all sorts of things like that we've put in place to help with it. But it's a really important issue. Mental health is something that's a high priority for us. We are investing more and more in making sure that we have we're taking care of the students who come and may have some issues there. We've actually, frankly, seen a growth in mental health issues on our campuses even before COVID-19. So this is something that we're paying close attention to. We are investing in it in Chicago, in Urbana-Champaign, and Springfield, so that we have turbocharged capabilities to help our students with the stress that they're feeling. And there's no question that that's happened. Even though most of our students have somehow or other sailed through the semester and come up with their, many of them graduating, of course, without ceremonies, but happy with that. But you put your finger on something that is a significant growing concern of ours, and we will be investing in that and making it a significant priority going forward.
Thank you. I think we might have time for one more call. We have T-Fen on the line about what are the preconditions for reopening the campuses, about testing and space, and how we will make our students and our staff and faculty feel comfortable. So T-Fen, you are live with President Killeen.
Yes, thank you, President Killeen. I just would like to know that in order to reopen campuses safely, that we really need to meet the three preconditions. They are reoccurring rapid testing, contact tracing, and space for isolation, self-isolation for positive cases. So I would like to know, I wonder if you can actually give us some more details about that, how we are able to, for all three campuses, being able to meet those preconditions seamlessly so that we can actually responsibly reopen the campuses.
Great question, T-Fen. I hope I hope you're a student, or maybe you're not a student. But anyway, it's a great question, and yes, it's the question we're working on intensively right now through all of these task forces. And let me give you a little bit of a sense of progress. We were asked by the state to help with testing in the state of Illinois. We were asked directly. DPI was tasked to help with that. We got into that, and the testing in Illinois has now gone from where it was then, which was about 4,000 a day, to 30,000 a day. And I feel proud because we contributed to that. We purchased supplies. We staffed up labs to include it. We are actually building VTMs, which are needed for that. We purchased swabs. We found ways to do that. We did the logistics. We did the siting. We identified vulnerable populations and how many were needed, et cetera. So we started on the testing, and we're also working on new ways of doing that. For example, we're doing the point-of-care testing right now, which can be, which is a blood draw actually, but it can provide a result in 15 minutes. And we've got several machines that are able to do that with a lot of throughput. We're talking about thousands of tests can be conducted that way. We're looking at the saliva testing that is coming out of other institutions, and we're designing the cups to allow for saliva testing, which could be self-administered. And so we're committed, just on the testing side of it, of building it out so that there's regular testing, and that students will feel that they can, if they have symptoms or even asymptomatic, can get testing. And then we have to have the contact tracing. As you know, we're advising the state on that too, and Governor Pritzker wants to hire 3,000 contact tracers and train them. We're looking at the training aspects of that. We have something like 200 graduate students who have already volunteered to become contact tracers. As you know from your sophisticated question, you've got to test and then react quickly, because if it takes days for the test results to come back, then the transmission can occur. So testing at scale and contact tracing rapidly, and then finding ways to isolate. And of course, we've got teams working on all of these. We may need to get some special hotels to add to our ability to isolate and quarantine people who have who need to be isolated. We've already got a wing set aside of a dorm in Chicago that is doing that. So you're asking exactly the right question. We're working intensively on that. But I would say, maybe to reassure you, we're working at a leadership level. We're not waiting for others to give us their recipe. We're actually in a leadership role on testing, contact tracing, quarantining, and isolating. So our approach will be the best you can find anywhere. Now we want to make it as good as it can be done feasibly, given our situation, and the clock is ticking, of course. but we're already working intensively on that. I'll give you another example of what we're doing since you asked for specifics. We've just purchased 60,000 flu shots, which is double the number we would normally do, because in the fall we want all of us to get the flu shot. We don't want to be running out, and we're actually going into procurement overdrive so that we're not, in a month or two facing demand supply issues, so we can't buy things at sufficient scale. So all I can tell you is you've asked the perfect question, and we're working on all of those things, and we've already made a lot of progress. I hope that's good enough for now. Ask the same question a month from now, and hopefully we'll have more to say.
That sounds great. Thank you.
Thank you.
Thank you. I think that's the end of our questions, President Killeen. If you have any final comments, and that's our last question.
Well, thank you very much, everybody, for joining us this evening and for all of the questions. And everybody's paying close attention to this. I think the issues of advocacy, which I stressed, are really important because the community engaged alumni can really help by making their presence felt in these key decision places. There's a key decision to be made in Washington, D.C. in the next weeks, and there are key decisions to be made in Springfield, which will materially help the ability of the University of Illinois system to perform to its full promise. But I can assure everybody listening that no matter what the budgetary envelope is, we're going to work as hard as we can to make you proud. And our faculty, our staff, and our student body are just amazing. And it's just every day is inspiring to me. And but thanks for being part of this overall community, and I really appreciate you staying the whole hour this evening.